the way we get through this, and we will get through this. We will get through this. There's another side to COVID. But the way we get through this is by working together with a sober approach to this and using sound science.
We really need the public's help with helping contain the spread of the disease, because we can't do everything on our own. We do our best to give people information, keep people healthy, but we really need your help in following public health guidelines when you put them out, staying home for 14 days, calling your healthcare provider before you go into the clinic if you suspect you may have been exposed to COVID-19.
So the availability of tests is now becoming more widely available as of recently as Monday.
As Dr. Devlin has mentioned, it's not a matter of if this ever occurs, but when it occurs.
Please try to focus on scientific evidence, on facts, on what's happening, evidence-based information. It's very important.
There's a lot of papers going around showing different numbers, but I would stick with WHO and CDC if you're going to be looking at this information.
We would ask that students, faculty, and staff take precautions over the spring break period that we're all going to be entering in here too quickly.
If your destination would be upgraded to a higher travel advisory level 2 or 3, when we return, we'd ask that you stay home for 14 days to monitor for any signs of illness.
Stop shaking hands would be one of the things that I would recommend. Wash your hands with soap for at least 20 seconds.
Really cover your cough and sneeze with your forearm, not with your hand.
And then avoid touching your face.
And do your best to stay home when you're sick.
Consider cleaning the surface of your phone.
I would also recommend regular cleaning at home. Regular over-the-counter cleaners are effective. You don't need any special strength cleaner or anything like that, but just make sure you're doing regular cleaning, particularly of any shared surfaces, counters, doorknobs, light switches, anything that multiple people touch. So we get a lot of questions about whether or not the general public need to be wearing masks, and our general recommendation is no. The standard surgical mask that people think about wearing when they go out or when they're in a clinic, that's really designed to help contain illness when someone ill wears, when it catches all the droplets and tries to contain the virus from getting out of the person's body. They're not protective against other people becoming exposed.
This is not the first emergent infectious disease that we've seen. Again, as you've heard, they are coming more commonly now because of all these different factors that Dr. Zeman and I talked about. So we've had some in the past. We have this now. I guarantee you this is not the last that we will be getting.
So as Dr. Zeman presented, that we believe this virus originated and jumped to humans from animals, and it appears that it's able to jump back. The full extent of that and the full picture that is still needing to be understood, and that'll take some more research before we get a full grasp on that. Early indications are that it can jump to pets and causes a mild illness, but then it does not jump back to humans from there.
We don't know about this particular virus if it's going to follow suit with other coronaviruses, but they do not like warm weather. So usually at that point on the SARS epidemic that we saw previously, that went away during the summer months, and we're hoping that follows suit. But another thing that we're noticing now is in China and South Korea, their new infection rates are drastically reducing. So we're seeing that we can do countermeasures and it can reduce the spread of that disease.
All on-campus courses will switch over to exclusive online instruction beginning on Monday, March 23rd through at least Friday, April 3rd. Additional information regarding this switch and other updates can be found on our website, prepare.uni.edu. And if you have any specific questions, you're welcome to email those to prepare@uni.edu. The Union or Rod Library or other areas on campus, the campus is remaining open and operational during this time. So those areas will be available to our student body and our university community.
We have approximately 250 internationals on campus at any one time, and those students, maybe several of them and it may be just more than several, maybe quite a few of them might remain on campus over the summer months. We are asking those students now to respond to surveys that I know the ISSL office is doing to learn where they plan to be over the summer, and if they do plan to be here, to tell us so we can help plan for their experience here. Say if they need courses fulfilled, we would try to make some courses available to them.
Additionally, we recognize that there is an emotional impact for our students, and the Counseling Center has walk-in counseling sessions available Monday through Friday from the hours of 8 to 4:30.
Biased behavior towards others because of the fact that they come from a foreign country, I think, is just not representative of the values that we teach here on this campus. And anytime we see that kind of behavior, we should report it.